or helping to facilitate community-based testing. These are America's public health heroes, and they rarely, in fact, I doubt that there has ever been a time in American history where the leadership of the Public Health Service Commission Corps has had the privilege of standing here on this stage behind the President and Vice President of the United States, and just wanted to commend that. In terms of our capacities in our healthcare system, any pandemic like this runs the risk of exceeding our healthcare system capacity, and we must acknowledge that. That is precisely why the President and Vice President's strategy is, as Dr. Fauci has repeatedly spoke, to delay and flatten the curve. The point of this is, instead of a spike of the curve, to delay and flatten that curve with the hope that you can keep the utilization of resources to be within the healthcare system's capacities. In addition to that, the entire point of our pandemic planning over the last 15 years has been to put extra flex into our healthcare system. That's why we have hospital preparedness grants that we fund every year through our preparedness program. That's why we have in our strategic national stockpile ventilators, field hospital units like MASH units, if you'll remember those, that have capacity for hundreds of individuals. In terms of supplies, obviously this is an unprecedented challenge, unprecedented. And so we will work to increase the supplies of personal protective equipment, of ventilators, of field medical unit hospitals that we can deploy. We have tremendous supplies, but we want to acquire more. And that's thanks to the bipartisan work of Congress funding the emergency supplemental that gives us the money to scale up production here and abroad, and we're doing that. We don't disclose concrete numbers on particular items for national security purposes, but we have many ventilators, thousands and thousands of ventilators in our system. We have received so far only, I think, one request for just several ventilators. One of the things in terms of hospital capacity that's going to be really important is a really good learning from China that we got from the World Health Organization team that went there, is if we have communities where we have enough capacity where we can put people who are positive with COVID-19 and have them be exclusively reserved for individuals who are positive for COVID-19. This reduces our need to try to protect patients from other patients because they're all positive already. We need to protect our healthcare workers and our service workers in those facilities. This gives us reduced burden on personal protective equipment, but it also can give us greater capacity as we put field medical shelters up, as we consolidate into single facilities, as we don't need individual rooms, negative airflow, isolation, et cetera. A vastly more efficient utilization of our healthcare system. This is all part of the planning work that we've done and are promulgating throughout our healthcare system. So that's our strategy. We're going to keep building that capacity, though.
Very good.
Mr. Vice President, consider using the military.
Go ahead.
Mr. Vice President, you talked briefly about trying to make information more accessible online. So can you give us a timetable for when you think a website will be available based on your conversations with Google? And secondly, and this might be to the broader team, can you also talk specifically about how many of these tests have been sent out to states and how many you still have to send out?
Well, let me say that we're working with Google, but we're working with many other tech companies, and we're truly grateful for the efforts of tech companies in disseminating best practices and guidance for citizens online all over the country today. Those resources are available, and we've literally heard not only from Google but from Facebook and Amazon, and the public spiritedness that's been reflected there. Is a credit to those great companies and a credit to all the dedicated Americans who work there. Our best estimate, and literally the team has been working around the clock since Friday, is that at some point early in the week that we will have a website that goes up, the purpose of which will be for people to go and first fill out a questionnaire so that they can identify whether they fall in the category that Dr. Birx described would indicate the need to have a test. And then once they go through that questionnaire, then our objective is as more and more of these sites come online, run by state governments, working in cooperation with our team, our public health service team, and FEMA, and also working in cooperation with local businesses and retailers, that people will know how to not only find it, but also the objective would be for them to literally be given a time that they can go and report for the test. But let me let the Admiral speak to the timing on the testing and unpack that for you.
So in our design, I just want to emphasize we talk about testing and we talk about so many things, but we're really talking about people, and we're trying to make this a very person-centric experience to easily access the system, to give clear guidance about how to go, when to go, information that even if you're not really indicated for testing, information you need to help protect yourself and your family. And then on the back end, very customized reporting. And we're talking literally about having telephonic services to call individuals who've been tested, let them know yes, no, and what the next steps are. So we've tried to really envision this through a patient experience. So let me talk about the testing. Progressively over this week, there will be roll out to different laboratories of approximately 1.9 million tests. There are many centralized laboratories, the behind the curtain that you never see after you give your blood, and you saw some of the CEOs in the Rose Garden last week, like Quest and LabCorp, that are fully able, ready to run. They have been testing already, but fully able, ready to run within the first part of this week, the very high throughput testing. The 2,000 laboratories that are around the country that have a different platform, one that's amenable to so many labs, not the big, hugest, highest output, but very high throughput laboratories, are progressing. They have to adapt the test slightly to the machines and get used to this. They will start lighting up Monday, Tuesday, Wednesday, Thursday. I can't give you the precise timeline, except it has been an absolute priority of the laboratory associations, of Thermo Fisher, the company that made this test. You heard the president predict that it might be approved within 24 hours. On Friday, I think it was 5 hours after that, in the middle of the night, that the FDA approved that. And that's the one that's going to be widely disseminated, high throughput, that's going to be available. So I know you want a specific time when these will light up progressively over the week. When that happens, there will be a centralized opportunity, like in the Quest and the LabCorp. There will also be distributed opportunities, like in all the major hospital systems and labs that are in your area. And then that number of 1.9 million goes up dramatically in the weeks coming forward. I'm not going to say that the lab testing issue is over, because it's not. It's entering the next phase. But the much higher priority now is, now that we have the testing available, how do we get people into the system to be tested in the appropriate, prioritized way? And that's what we've really been focused on. Information, website, points of distribution model that are tried and true, enabling the states, providing them with equipment, supplies, know-how, and Commission Corps officers as needed to help man these or staff these as we move forward. So you'll see this rapidly developing over the week.
All right, guys, last question. Mr. Vice President, are you considering domestic disaster?
Mr. Vice President, market futures are down despite the dramatic move from the Fed that the President applauded, which suggests that there's still concern about that we haven't done enough to respond to the economic impact of this deal, or of the coronavirus. I'm wondering when specifically we're going to hear from the White House about how you're going to impact or help impacted industries, from the airlines, the cruise ships. And secondly, I wanted to talk about the legislation that came out. The White House fought to exclude workers at larger corporations from paid sick leave. And so I'm wondering what you say to somebody who flips burgers at McDonald's or works at one of these large chains that's worried about staying home and potentially missing a paycheck.
Well, first, let me say we strongly support the House legislation, which, while it gives some flexibility to small businesses, which will be reflected in the regulations going forward, no American worker should worry about missing a paycheck if they're feeling ill. And if we can't say often enough to our fellow Americans, if you're sick with a respiratory ailment, stay home. And as you've heard here today, over the course of this next week, we're going to see testing become much more widely available, beginning in the areas the CDC will focus us as the highest priority. But working with members of Congress, we've made sure that not only is testing free, but we have every confidence that the extension of paid and family leave to Americans will be extended in a way that should give every American that confidence. And let me say, with regard to the economy as a whole, I think the Treasury Secretary has been working very diligently on the President's behalf. We had the supplemental $8.3 billion bill. The House has now acted on important legislation that we fully support, and we hope the Senate takes it up this week. But whether it be the airline industry or the cruise line industry or the hotel industry, as the Secretary said recently, we are in just the first few innings of this effort. And the President has directed us to bring the full weight of the federal government to bear to confront this crisis, first and foremost on behalf of the health and safety of the American public, but strengthening our economy, ensuring that those vital industries will be able to find their way through and grow strongly once this coronavirus has passed will be a priority. And we're already in discussions with members of Congress in both parties about that next phase of the support. But let me say, as I close, we will be back in the morning tomorrow for a briefing, and also we'll have a health briefing in the afternoon. But again, I know I speak on behalf of the President when I say how grateful we are for all the governors in the country, for all the local health officials, everyone that's coming alongside Americans. We encourage every American to continue to use best practices and common sense. Even if you're not in a high-risk category, as the vast majority of Americans are, remember those people around you who may well be. Remember those seniors with underlying health conditions. It's the reason why you need to keep washing your hands. You need to keep practicing good hygiene, cleaning those counters and surfaces to make sure that we don't convey the coronavirus to them. And finally, let me also just let me add to all the wonderful accolades of the Public Health Service personnel behind me. These are all heroes. And I have to tell you, having been over at HHS yesterday, having seen the way these people drop everything and are rolling into this effort to expand testing across the country, it'll be these people in these blue uniforms that you see at an awful lot of these points of distribution, these community centers around the country. And for all they're doing today, for all each one of them done throughout their career, I know they have the thanks of this President, his Vice President, and the American people.
Sir, how
Thank
can you
you.
say Americans shouldn't be concerned about missing a paycheck?
Why
How can you say
exempt
that?
companies?
The Senate has plans to take up an economic aid package in response to the coronavirus. The legislation already passed by the House would require free coronavirus testing, provide paid medical and family leave, and bolster food aid and unemployment insurance for those affected by the outbreak. A final vote by the Senate is expected this week at a time to be determined. As always, you can follow the Senate live on C-SPAN 2.
It's easy to follow the federal response to the coronavirus outbreak at cspan.org/coronavirus. Track the spread throughout the U.S. and the world with interactive maps and charts. Watch briefings and hearings with public health specialists anytime, unfiltered, at cspan.org/coronavirus.
Joining us on Newsmakers is Guy Cecil. He is the chair of Priorities USA, and joining us with the questioning, Susan Page of USA Today, Zach Montalero of Politico. And let me begin. What a week it has been, really upending the lives of all Americans. The stock market now in bear territory. How does this change the political landscape from your standpoint?
Well, certainly there's a lot of short-term changes, right? I mean, just the way that the candidates for president, for Senate, all around the country are campaigning. Changes their fundraising apparatus, changes the way the primary looks. I mean, frankly, it changes if you're a governor or an election official in Illinois or Ohio, it changes the dynamic of how you're administering those elections. But I think most importantly, what it does is it highlights sort of the primary messaging and issues that we've been raising about Donald Trump and this administration's ability to move away from impulsiveness and arrogance and chaos and to actually solve the problems and not simply be about the politics of the election. And I think we're going to be living with the consequences of this for a while, but there's no question in the short term, it's fundamentally changing the way that we are running campaigns in the country.
But on the issue of the testing kits in particular, the president is blaming the Obama administration.
Well, I mean, this is nothing new. Everything that good that has happened in the country is because of Donald Trump, and everything terrible in the country happened because of Barack Obama. The reality is Donald Trump's been president for 3 years. If there was an issue with the CDC, he should have solved that problem. He shouldn't have been eliminating government officials that were supposed to be dealing with pandemics. He shouldn't be sending mixed messages about test kits. Let's remember, it was just a couple of days ago, there were plenty of test kits, according to the administration. Now there aren't enough, and the reason is because of Barack Obama. So I think we just have to understand that this administration is engaging in a massive misinformation and disinformation campaign, which is ultimately going to cost American lives. And I think when you compare that to the leadership that's being displayed by Nancy Pelosi in terms of the legislation she's putting on the floor today, you look at the speeches that were put forward by Bernie Sanders and by Joe Biden, it's a pretty stark difference between how this administration is handling a crisis and how the Democrats are handling the crisis.
Susan Page of USA Today.
I know that we all think of this as first and foremost a public health crisis, and we're thinking about the people who are sick. It's also a political issue, and I'm sure you watched President Trump deliver his Oval Office address this week, and I wonder what you thought about that.
Well, I think the primary purpose of an Oval Office address is twofold, right? At this time, the first is to calm fear, and the second is to provide information. And I think on both of those counts, the president failed. I mean, within 5 minutes of the conclusion of that speech, the administration was forced to put out multiple corrections based on the information he was sharing. And I think the other thing, a lot of this is around, coverage of the NBA and the NHL and all of these events that are being canceled. My church service this Sunday is going to be a live stream instead of in person. But let's remember that there are waitresses and janitors and grocery store clerks that don't have the options of social distancing. They are working in fields that require interaction with people. Where is the sort of advice and direction and the ease being provided to the people that are really being forced to still work and interact with people because their job requires it? That's what we should have been hearing from the president, not misinformation about shutting down travel and a lack of information around testing.
We who cover President Trump over and over again for the past 4 years have said